Working in the hospital, I see MRSA, which is also known as methicillin-resistant Staphylococcus aureus. I will call it MRSA. It's a lot easier to say. More than I see anything else in the hospital. About 1 in every 31 patients get a healthcare-associated infection, says the CDC. The CDC publishes data reports to help track progress and target areas that need help with these problems. When it comes to leaving the hospital with a said infection, about 2 in every 100 people carry MRSA outside of the hospital in their everyday living. You can carry the bacteria in your nose or your nares, and most do not develop a serious MRSA infection. Some people may not even know that they have it. This is kind of what MRSA looks like. It's a not so gory picture. Almost looks like chickenpox, but you know, if you see stuff like this, make sure you do get it checked out because it could be MRSA. This is kind of statistics from 2010 to 2016. Doesn't really change. I think it went down by 0.09%, so it is very common. The severe problems that MRSA can cause are bloodstream infections, pneumonia, surgical site infections, sepsis, and even death, says the CDC. MRSA has become immune to many types of antibiotics. So trying to take antibiotics, I mean, you're not going to get rid of MRSA. It can almost stay with you for a very, very long time. MRSA is a common bacteria that lives on our skin. Most of the time will not cause us any ill effects. However, the problem only arises when you have a cut or a puncture or a wound that is open, and then the staph will then enter your body. And that's when if it goes unchecked, you can develop sepsis. Sepsis is very severe. I've seen it in the most critical conditions while working in the hospital, and you need to get it checked. If you don't, very, very life-threatening. It's a life-threatening condition, and it's caused by your body's response to an infection, which can lead to tissue damage, organ failure, and again, death. I've seen sepsis has killed and disabled millions of people. It requires a rapid treatment for survival. It's very, very critical. If it is left untreated and gets in your bloodstream, sepsis again will kick in, and it will be a fight for your life. I think some people don't think, the little red bumps are gonna cause such pain and treatment, but yes, it does. It's very, very serious. But then also you can live with it in your nares and be fine. So some of the times that doesn't happen, but when it does, it'll cause sepsis, and sepsis is so bad. How common is MRSA in the hospital? Like I said, it's very common, and it's about 33% of people that have it, or 33% carry it in their nose. The CDC has been using long-term and short-term surveillance projects to keep track of these MRSA infections happening in the hospitals. How much is it occurring? Where is it happening? And how is it being spread? And like I said, studies show that 1 in 3 or 33% carry the MRSA in your nose, with no other illnesses along with it. If you ever have MRSA in your nose, don't be concerned. You can get it treated, but like I said, no serious infection will come with that most of the time. From 2005 to 2012, rates of MRSA and bloodstream infections have decreased by 17% each year. That's in your bloodstream. Declines in MRSA bloodstream infections slowed again from 2013 to 2016, according to the CDC. In a hospital setting, you are surrounded by a large number of people, including patients, doctors, nurses, volunteers, visitors, kitchen staff, housekeeping. all of whom can be carriers of MRSA. It is a very common in the hospital. I mean, it also depends on the severity of it. It can be in your nose or it can be in your wound, and you can see different kind of aspects of it. That was kind of according to aftermath.com. I have a few pictures. I'll show them first. How to prevent or reduce your risk of MRSA infection. This is a picture of kind of how at the hospital you go into isolation for things like this. They have the goggles, they have the mask, your gown, and then your gloves are right here. It'll also show you a sign kind of like this. Stop. It's a contact precaution. They have different kind of precautions throughout the hospital. This one's just by touch. They have droplet, which is if you have influenza and you cough, you have to have a mask because it's droplet. And then eccentric is kind of like through your feces. And so there's different types of isolation, and this one is contact. It'll say right off on the top, it'll say stop. Everyone will always say, wash your hands. And then it says what doctors and staff must do and everyone must do. So also if you did come to visit, this is a standard one, but so staff would go in with gowns and gloves, and then they would use, disposable stethoscopes or whatever. But if you also did come in to visit your loved one or whatever, gowning and gloving would be ideal for you to do while visiting them. So like I said, keep your good hand hygiene, keep good body hygiene, keep cuts, scrapes, wounds clean and covered until they are healed. Avoid sharing any personal items, and get care early if you think you have the infection. Like stated before, MRSA is acquired by the staph infection only through an open wound or a cut. The best way to prevent any of this spread of infection is wash your hands. Wash. Be aware if you are visiting anyone in the hospital, whether they have MRSA or not, always wash your hands because it is around. It's on everything it can be. And that is from the aurorahealthcare.org. And when in doubt, get it checked out. You can get MRSA treated with antibiotics. I know I said most are immune, but that's if somebody has it and like they constantly have it. If you just have it and you go get it checked out the first time you had it, antibiotics is the first. If it stays with you, then that's when it's kind of like they aren't working anymore. But if you ignore your symptoms, the infection can be fatal. It depends on the severity of it again. But if you're on your medicine and it doesn't get any better, so you take your antibiotic and it's just still not getting any better, go get more medical help, and then they can figure out, where that infection is right away. Data reports help track the process of this and the targeted areas. There are many ways to prevent the situation, and it is all about being aware. I've worked in the hospital for 2 years, and MRSA is the most common infection that you see. It's to the point where if somebody does have it or a history of it, they used to isolate them. And now, if you have a history of it, or if it's isolated, so if it's in your urine, or if it's in your nares, they kind of tell you to be aware, and you don't have to always isolate anymore because it was everybody. Everybody was in isolation. I have seen it be easily treated, like in that sense, and I have also seen it in the worst. I was the tech up in critical care, so I've seen sepsis. I've seen how intense it can be, and it's crazy because you don't think that it can be that intense, and then you see it and you're like, oh, it is really intense and it is really serious. You must be very cautious because it can be very fatal. Being educated when coming in for surgery or just simply visiting a loved one is good prevention for this MRSA. And always, always, always wash your hands. Thanks.